Hello everyone, in this video, we would like to present about the Alzheimer's disease, such as the diagnosis, the risk, the effect, last but not least, on how to care people with the Alzheimer's disease. But before that, I would like to introduce you all the presenters in this video. I am Nur Akila Husna, dan Rosdianti, Nur Amira, and Nuha Naima. Stay tuned! So, what is Alzheimer's? Alzheimer's is one of the well-known neurocognitive disorders in which death of the brain cells causes memory loss and neurocognitive decline. The prevalence of overall dementia rises steeply with age. U.S. cancer data estimates suggest that approximately 7% of individuals diagnosed with Alzheimer's disease are between age 75 and 84 years, and 40% are 85 years and older. The percentage of dementia attributable to Alzheimer's disease range from about 60% to over 90%, depending on the setting and diagnosis criteria.
As for the diagnosis of Alzheimer's, for major or mild neurocognitive disorder, it is probable when either of the following is present. Number 1. Evidence of a causative Alzheimer's disease, genetic mutation from family history, or genetic testing. Number 2. All three of the following are present. The first one, clear evidence of decline in memory and learning, and at least one other cognitive domain. And second, steadily progressive, gradual decline in cognition without extended plateaus. And third, no evidence of mixed etiology. Major or mild neurocognitive disorder is depending on the level of severity of the symptoms.
Let's talk about risk. Who is the one that are in risk in getting Alzheimer's? A person is at risk when 1. They have a traumatic brain injury. 2. They are in the age where it is likely to occur, which is 65 years old and older. 3. Have a genetic susceptibility that related with causative Alzheimer's disease genes. And 4. Individuals with Down syndrome, also known as trisomy 21. They may develop Alzheimer's disease if they survive to midlife. Moving on, the effect of Alzheimer's. It is not far from the truth that Alzheimer's greatly affects individuals as it interferes with daily life. This included unable to complete tasks without assistance, have drastic change in personality or temperament, difficulty in communication, withdrawal from society, depression, memory loss, disorientation to everything that once familiar, and decline in physical health, control, and balance.
Now we are going to share about how to care for patients with Alzheimer's. There are 3 stages that we should know, along with a few keywords that we should remember at each stage. At an early stage of Alzheimer's, we should remember these 3 things: accept, learn, and prepare. Upon knowing our loved one's diagnosis, we must learn to accept and take time to process the news. Know that our loved ones are the ones who will be most affected, so let them express and come to terms with the news. Learn all about Alzheimer's and its condition by making use of the sources from books, the internet, and from people as well. The most important thing is to be prepared and support them for the future. In the middle stage, the key word that we should know is ask, routine, and communicate. Don't be afraid to ask help from family members, friends, or volunteer organizations. Reach out to people when you need it, as your well-being will also affect the patient's well-being. It is advised to keep a constant routine to help the patient feel structured and feel familiar with their surroundings. It is also advisable to involve them in daily activities to stimulate their senses and communicate with them as much as possible. At the late stage of Alzheimer's, we must prioritize these 2 things: connect and needs. As the late stage is where the patient's condition deteriorates. We should try our best to make time each day to connect with our loved ones. Don't neglect the patient's needs as well as your own, and be sure to get support and help when you need it. Cherish the moment we have with the patient and let them know you love them and care for them until the end.
As for the conclusion, according to the DSM-5, most individuals with Alzheimer's disease are elderly and have multiple medical conditions that can complicate diagnosis and influence the clinical course. Therefore, we should take extra care of our loved ones as they get older and support them if they are suffering from this disorder. That's all from our group. Thank you.